Okay guys, we are going to talk about the topic systemic lupus erythematosus. Systemic lupus erythematosus is an autoimmune disease involving multiple organs characterized by a vast array of autoantibodies. Okay, particularly the anti-nuclear antibody that is also called as ANAs, anti-nuclear antibody. In which the tissue injury how it occurs mainly is because of the formation of immune complexes and binding of antibodies to various cells and tissues. Binding of antibodies to various cells and tissues. Now, SLE is a fairly common disease and it occurs in 400 people per 100,000 population. That is 400 per 100,000 population. Next is female to male ratio is 9:1. Female to male ratio is 9:1. Next, if you see the prevalence of this disease, okay, is 2 to 3 times fold in blacks and Hispanics than whites. Okay, now let's look at the spectrum of autoantibodies in SLE. Spectrum of autoantibodies in SLE. Spectrum of autoantibodies, when we look at it, okay, some antibodies recognize the nuclear and cytoplasmic components while others are directed against the cell surface antigen of blood cells. Okay, now we look at anti-nuclear antibodies in detail. It's also called as ANAs. Okay, in this the antibodies are produced against DNA, against histones, then against non-histones, okay, bound to RNA, and against nucleolar antigens. Now ANAs are produced against nucleolar antigens. The patterns of ANAs, okay, now let's look at the patterns of ANAs. There are different patterns, that is homogeneous or diffuse pattern, rim or peripheral pattern. Next is centrometric pattern, speckled pattern, nucleolar pattern. Okay, let's look at the pathogenesis of SLE. Okay, pathogens of SLE is divided mainly into genetic, environmental, and immunologic factors. Genetic factors. Let's look at in detail about genetic factors. Familial association and HLA association are two main points for genetic factors. Familial association is first degree relatives. It's more easily transferred, and monozygotic twins are more probable to get it than dizygotic twins, that is 25% more probable. Environmental factors, exposure to UV, gender bias of SLE. Okay, in case of gender bias of SLE, it is depending on sex hormones and genes present on the X chromosome. Okay, and last point is drugs like hydralazine, procainamide induce SLE. Now let's look at the immunologic factors. Okay, let's look at the immunological factors. Okay, first is failure of self-tolerance of B cells. Okay, this leads to defective elimination of self-reactive B cells in the bone marrow. Next is CD4 plus helper T cells. In this, what happens is the CD4 plus helper T cells escapes the tolerance. Okay, therefore it contributes to high affinity autoantibodies. Okay, next is type 1 interferon, then TLR signals. Okay, in this TLR signals, they recognize the DNA and RNA. TLR9 and TLR7. TLR9 is DNA recognizing and TLR7 is RNA recognizing. Let's look at the mechanism of tissue injury. First is formation of, I told you earlier, formation of immune complexes. Okay, this is type 3 hypersensitivity. Okay, next is autoantibodies. This is type 2 hypersensitivity. Okay, next is nuclei of damaged cells. Okay, react with ANAs to form LE bodies. Okay, next is antiphospholipid. Antibody syndrome. What is it? Antiphospholipid antibody syndrome. Okay, in this what happens is antibodies are produced, that is autoantibodies, okay, are produced against phospholipids that causes venous and arterial thrombosis. Okay, the next one is neuropsychiatric manifestations. Neuropsychiatric manifestations. Okay, next let us look at the clinical features. Okay, the clinical features of SLE, systemic lupus erythematosus. Okay, let's list down the main clinical features. Okay, it causes malar rash. Okay, then it causes discoid rash. Okay, then it causes psychosis, photosensitivity, deformity of joints, pleuritic chest pain, abnormal urinary findings, ANA suffer. Okay, these are some of the clinical features. Okay, now let's look at the drug-induced systemic lupus erythematosus. Okay, I earlier mentioned that two drugs which causes drug-induced systemic lupus erythematosus is hydralazine and procainamide. Hydrazine and procainamide. What this causes is it causes drug-induced systemic lupus erythematosus. Okay, also anti-TNF therapy in rheumatoid arthritis causes drug-induced SLE. Thank you guys. Please subscribe and like and share this video. Recap of whatever we learned. Systemic lupus erythematosus is an autoimmune disorder, and ANAs are formed, anti-nuclear antibodies are formed. Formation of tissue injury happens by formation of immune complexes and binding of antibodies to various cells and tissues. Okay, there are 400 people per 100,000 people that get SLE, and female to male ratio is 9:1, 2 to 3 times fold in blacks and Hispanics than whites. Okay, let's look at the spectrum of autoantibodies in SLE. The main autoantibody that is formed in SLE is anti-nuclear antibodies, that is ANAs. Okay, ANAs are produced against different antigens, that is against DNA, against histones, against non-histones bound to RNA, against nucleolar antigens. Okay, now let's look at the patterns of ANA. First is homogeneous or diffuse pattern. Okay, next is rim or peripheral. Okay, pattern. Next is centrometric, spectral pattern, nucleolar pattern. Let's look at the pathogenesis. Pathogenesis is divided into three types, that is genetic, environmental, and epidemiological factors. Genetic factors includes familial association and HLA association. Familial association is first degree relative, is more probable to get it then monozygotic twins is more probable to get it than dizygotic twins, that is 25% more probable. Okay, HLA association, environmental factors, okay, exposure to UV and gender bias of SLE, that is depending on the sex hormones and the genes present on the X chromosome. Okay, drugs like hydrolysine and procainamide induce SLE. Next is immunologic factors. Okay, immunologic factors is failure of self-tolerance to B cells. Failure of self-tolerance to B cells, it causes the depletion of the self-reactive B cells. Okay, CD4 helper T cells. What happens in this case is CD4 helper T cells escapes the tolerance and contribute to high affinity autoantibodies. Type 1 interferon and TLR and signals. Okay, TLR, there are two types of TLR signals. It signals the DNA and RNA. Okay, TLR 9 signals DNA, TLR 7 signals RNA. Mechanism of tissue injury, I earlier told that there are different types of mechanism of tissue injury. Main is formation of immune complexes, that is type 3 hypersensitivity. Autoantibodies are produced, that is type 2 hypersensitivity. And let's talk about LE bodies. What are LE bodies? Okay, the nuclei of damaged cells react with ANAs to form LE bodies. Next is antiphospholipid antibody syndrome. What happens in this is autoantibodies are produced against phospholipids, okay, which causes venous and arterial thrombosis, neuropsychiatric manifestations. Let's look at the clinical features of SLE. The main clinical features are malar rash, discoid rash, psychosis, photosensitivity, deformities of one or more joints, pleuritic chest pain, abnormal urinary findings, and ANAs are produced. Drug-induced SLE, earlier I told us, two drugs which causes drug-induced SLEs, hydrolysine and procainamide. Anti-TNF treatment or therapy in rheumatoid arthritis also causes drug-induced SLE.